Hi, my name is Jenny and this is my assignment of a presentation of a personal development plan, a SWOT analysis and supporting literature. This assignment will assist me in planning my career and future practice and will help and allow me to develop my own personal and professional growth through the use of individualised learning goals that are focused on the next 5 to 10 years. There are 5 main parts to this assignment, including the first slide where I will discuss my dream job, the rationale behind my choice and the need for this profession in the future to come. I will then break down my development of a SWOT analysis where my strengths, weaknesses, opportunities and threats will be evaluated to determine if I have the ability to succeed in my dream job. These will then act as stepping stones to help determine 5 goals, which will then be discussed in depth in the personal development plan. This will incorporate the NMBA standards and discuss the strengths and opportunities I have to help achieve certain goals. Throughout this whole assignment, research and supporting literature is assessed, and those will be assessed in the individual part of this assignment, followed by my conclusion to finalise this assignment. Nursing has always been a particular area of interest for me, and deciding to pursue with this degree has been extremely satisfying. After many clinical placements in a number of different areas, paediatrics has definitely been a highlight, and I believe it has a potential to motivate me every day. Being young, I feel I have the potential to succeed in this position as I don't have the emotional burdens on me such as a family of my own. I believe I have the skills to deal with children not only on a clinical level but at a play and distraction level, as I've brought up 2 younger siblings of my own. What motivates me to become a nurse practitioner is the level of knowledge and the position in which I will be in and the responsibility that I will hold. This position will allow me to work closer with the interdisciplinary health team and provide ultimate family-centred care. Thankfully at ECU they hold a Masters of Nursing, which gets you the position to become a nurse practitioner. And there's a selection criteria for that. First of all, you need a Bachelor of Science degree in nursing. You need registration with APRA as a practicing RN. You need a postgrad qualification within the specialty area, which I have decided I want to work in oncology. And then within this specialty area, you need to have 3 years experience postgrad and 5 all up. So 3 in oncology and 5 years all up. And then after this, you need a professional associations membership, and then you can be qualified to go into the Masters of Nursing. In this degree, you have to be working a minimum of 20 hours per week in your specialised area of oncology while studying. So my goal for this would be to study part-time, which is 3 years, and work at the same time. There is a major need for this role in the future as clinicians are decreasing in number. It's better for the lower socioeconomic group for nurses to be able to provide the care that clinicians normally do. The role has been recognised in the government's health reform agenda. It promotes interdisciplinary team-based approaches, and the current salary for this position is on a Nurse Level 7 of $133,401. So this is my SWOT analysis. So through the use of a SWOT analysis, it has made me evaluate the external and internal factors that are either positively or negatively influencing my chances of achieving my wanted goals. So I'll mention a few today, but after mentioning them, it becomes clear to me that my strengths outweigh my weaknesses and my opportunities outweigh my threats, which gives me the hope that I will be able to succeed in my dream goal. I have a high consistent academic transcript. I volunteer for WA's only children's hospital for PMH. I have experience with raising children. I've cared for a boy with special needs. I have a high level of compassion and respect and believe firmly in family-centred care, which are known values to Princess Margaret Hospital. I'm a team player. I have a pharmacy background, so I have a lot of knowledge in medications and counselling of patients of many different issues and ages. My weaknesses are I find it difficult to delegate tasks to others. I'm not fully confident in all tasks set to me, yet I will research when needed. I am hard on myself and will put more pressure on me rather than sharing out the workload. I find it difficult to confront people in sad situations, letting my emotional stability sometimes get the better of me. My opportunities for the future is My past experience with children increases my chances of getting a position in paediatrics. I have been shortlisted for the first year graduate program with Princess Margaret Hospital. Princess Margaret Hospital offers a graduate development program to those who have taken part in any first year program. And there is a development of a new children's hospital which would create more open positions. The threats that I face are the number of positions available for graduate programs are lower than general private and public hospitals for children. Being only one children's hospital in Western Australia, positions are lower than general. The course to become a nurse practitioner is costly, and therefore I'd have to be financially stable before applying. Moving on now to my personal development plan. I have 5 goals. Starting with, I would like to have the ability to self-reflect on positive and negative events daily to help develop an appropriate professional benchmark. I will do this by involving the competencies. Professional practice, I will recognise and respond to unsafe or unprofessional practice and identify appropriate interventions to reflect on. A strength to this is being at university, I've had to go through a lot of reflections on a weekly basis through prac. This allows me to understand them and reflect on the outcomes. My opportunities are there are reflective workshops held within the university to develop my skills further, and I'll also hold a professional portfolio where regular reflections will be updated. My critical thinking and analysis, I will seek to gather feedback from colleagues alike and those from other health professions to help me to critically reflect on my own nursing practice. My strength here, I have experience in communicating through my current role in pharmacy and including all my clinical placements. I'm therefore confident in expressing concerns and gathering support. My opportunity will be working with the multidisciplinary team on a daily basis and learning and gaining experience through others. My provision and coordination, I'll document all necessary information to reflect back on and help them decide an appropriate continuity of care for all patients. My area of strength, the professional portfolio unit provided to us within university has a strong emphasis on reflective writing and forces us to document everything we feel is worthwhile. My opportunity is to keep a reflective journal. Collaborative and therapeutic practice, I will attend appropriate meetings, trainings and audits with health professionals so it will allow me to reflect and determine if my practice is of the highest standard. The strength here, I have been exposed to professional ward audits while on placement and have seen how other members reflect on their ability and mistakes. Opportunities for further development, the ward meetings will allow me to interact with other health professionals and the use of research will make me more confident. My second goal is to advocate for all my patients by having a good understanding of my role. Professional practice, I will understand and identify the cultural differences and beliefs of all patients so that I can provide effective care when considering their preferences. My area of strength here is through covering the culture and health unit through uni, where I've received high marks and a high level of understanding. To further develop, there are chances to work abroad. There is potential to develop my nursing care to those with many different cultural backgrounds. Critical thinking, I'll take any opportunities to seek additional relevant information from the interdisciplinary healthcare team. I have good communication skills, which allows me to do this, especially through my placement with the IPAC unit. And as a registered nurse, there will be many team meetings held for particular wards and patients. Provision and coordination, to be able to identify patient needs and priorities and be able to delegate their care in consultation with appropriate members. Strength, I have developed an understanding of the priorities of care. Opportunities, through a grad program I have the opportunity to go through different areas which will develop my understanding of how roles change between areas and patients. Collaborative and therapeutic, I recognise the differences between all health team members and understand the roles may change depending on patient circumstances. My strength here is throughout clinical placements we have had to stick strongly to our student nurse scope practice while working alongside a registered nurse, and this allowed me to extremely understand the nurse's role. For future development, my understanding of health professional roles will develop on a daily basis. My next goal is to complete a postgraduate certificate in paediatric nursing by the end of 2018. This is held through the Children's Hospital. My professional practice, I will make sure that I am educated in the best available evidence-based guidelines to ensure that my skills and interventions are appropriate. My areas of strength here is I have learned the importance of evidence-based practice through university and have the ability to search for the most up-to-date research. My opportunities for further development there are study days offered through graduate programs where they'll give me the opportunity to ask questions and research evidence. Critical thinking, I'll take the opportunity to reflect on my own practice so I can develop in areas that require development. Throughout many clinical placements, I've gained a good knowledge in reflecting. I have learned in particular Gibbs model, and this allows me to reflect on my feelings and how I can make things better. For future development, I will keep a personal journal of all reflections. Provision and coordination, I will ensure that I maintain an updated knowledge of all the hospital facilities' emergency procedures. My strength here is I have the ability to maintain a sense of control in times of distress and emotional discomfort. Through clinical placements, I've been involved in deteriorating patients, and being exposed to this has allowed me to debrief and reflect. My hospital choice holds specialty training days on and off the ward and available for all interested to sign up. Collaborative and therapeutic, I'll develop the communication skills to effectively establish, maintain and conclude therapeutic relationships. I've done this through being a pharmacy assistant where I've had to give bad news, give good news. My opportunities for development, throughout a grad program, I'll be given many opportunities to apply my communication skills with members and family. Number 4, to be accepted into masters. So professional practice, I'll ensure that I keep up to date with current knowledge regarding paediatrics. Critical thinking, I'll be able to provide evidence of how I participate in ongoing development. Provision and coordination, by reaching this level, I'll be able to communicate effectively with a multidisciplinary team. And collaborative and therapeutic, I will prove that I can provide a safe and secure environment for all patients and staff by adhering to all rules, laws and legislations. My goal number 5 is to gain employment as a nurse practitioner. Professional practice, I'll have an advanced understanding of legislative requirements, building my practice and supporting colleagues. Critical thinking and analysis, I'll support and contribute to ongoing nursing research to increase any chances of securing a position. Provision and coordination, be able to conduct a highly comprehensive and systematic nursing assessment. And collaborative and therapeutic practice, I will be able to establish a professional rapport with patients and colleagues to allow them to feel comfortable in expressing their feelings and concerns to me of a leader role. So they are my 5 roles. A few of them I've discussed my strengths and the opportunities that I have to develop them. I'll now move on to my literature review, where I've done 5, most of them focused on paediatric nursing. The first one was the core role of the nurse practitioner. This focuses purely on what the nurse practitioner does in Australia and New Zealand. This is relevant to the area of employment in which I will be gaining. It is up to date with the latest research, and it explains that the nurse practitioner has 3 major roles, and these are application of clinical knowledge, the role of leadership and advocacy for all patients and colleagues. The next literature is paediatric oncology nursing. This literature demonstrates and enforces the stresses and demands in the field of oncology nursing. It evaluates many studies to provide effective coping strategies for working with the oncology environment. This is an important read as it lets you become familiar with the issues you may face. Number 3, speaking to the deceased child. This focuses on end-of-life care, which is important in paediatric nursing, especially oncology. It emphasises on family-centred care and how you should speak to a deceased child to recognise their current presence. This study proves that paying attention and speaking to them after death will then promote their parents too as well and keep their continued bond. The 4th one is family-centred care of children in hospital. This outlines the basic elements of family-centred care in paediatric nursing. It explains the effects this has on the child and family. It evaluates the extent to which you should involve the family and where sometimes you are pushing the boundaries. And number 5, the influence of personal and workplace resources on graduate nurses. This is talking about how graduate nurses are turned off before attempting them themselves. It's an important read as it provides implementation strategies to cope with the new stressful environment. It explains resources that are available for support, reflective techniques, and shows that there is an existence of ongoing professional support and development. So in conclusion to my assignment today, This research has allowed me to have a clear understanding of what role of nursing I want to pursue in. Nurse practitioners are of high value to the health field and are becoming more desired and necessary each day. To become a nurse practitioner, you have to specialise. So my specialised area is oncology, and this has always had a major impact on me. The selection criteria for a nurse practitioner is suited to me. It has parts that have strengths in and parts that I will need to develop in. The SWOT analysis assisted me in uncovering my strengths, weaknesses, opportunities and threats. From the SWOT analysis, I was able to develop 5 separate goals that align each other in order to reach my dream goal. By following the NMBA nursing competencies, my goals are specific to my practice and achievable in a timely manner. And the supporting literature has had a strong focus point on paediatric nursing, as learning to succeed in this area will allow me to be the best of my ability in the clinical team leader role, such as a nurse practitioner. These are my references, and thank you for listening.